This looks like product placement, but it's really not meant to be.
So can everybody hear me okay? Good.
Absolutely, Jenny.
All right, great. Well,
Yes.
thank you. Well, welcome to our University of Maryland St. Joseph's Medical Center Cancer Institute Survivorship Week 2021. And as some of you may know, yesterday was National Cancer Survivors Day. It's the first Sunday of every June, and it's a day to offer support to cancer patients. And we thought that it would be an exciting opportunity to continue with a week's worth of events that can support the many challenges that come with survivorship and with the cancer diagnosis, cancer treatment, and then life after that diagnosis and treatment. So we know that with 16.9 million cancer patients in the US, that support is incredibly important, and we want to continue that ongoing survivorship awareness to promote resources, research, survivor-friendly legislation that all can help to improve cancer patients' quality of life during and after their cancer diagnosis and treatment. So we've put together an incredible week of events. I'll share my screen with you now. I think. So we know that they'll be of interest, support, serve you and your families wherever you are in your cancer journey. Our dedicated staff here at the Barbara L. Posner Wellness and Support Center and throughout the entire Cancer Institute is been part of this and all of these events that you don't want to miss. They have just incredible wealth of information, experience, and resources that really can be helpful. So please share all of this information with your family and friends. You can find this hopefully in an email that you received, or you can go to the URL, which is umstjoseph.org/superhero, or you can send us an email at cancerwellnesssupport.umm.edu or at umm.edu, excuse me. And then certainly give us a phone call if you have any questions and can't figure out where things are or are interested in signing up for some of the pre-registration classes that we have or events that we have. So now it's my honor to welcome the University of Maryland St. Joseph's Medical Center Cancer Institute Medical Director and Oncologist, Dr. Kimberly Schlesinger, to start our week of virtual survivorship events. Dr. Schlesinger will share thoughts on how the University of Maryland St. Joseph's Medical Center Cancer Institute strives to meet individual patient needs. She will also talk about the evolution of survivorship programs. Dr. Schlesinger will have a question and answer session for any questions you may have afterwards. So thank you for your participation. And now, Dr. Schlesinger, welcome to our Survivorship Week.
Thank you, Jenny. And can everyone hear me?
Yeah.
Excellent, excellent. I do want to thank Jenny and her team. This is really an amazing menu program of opportunities that really reflects our team's commitment to what we see as treating the whole patient. And Jenny and her team are so invested in making sure that we honor the spirit and the mind-body connection of all of our patients. So I do want to give Jenny and her team a big thank you for this. I am a medical oncologist and I see patients on the first floor of the cancer center. I also see patients once a week on the second floor in the breast center. And I've had about, I hate to say how many years of experience, but I've been an oncologist quite a long time, enough that my first child is in college and I had him during fellowship, so you can probably figure out the math there. I do see that it's, I'm looking at my screen here, a relatively small group. So my plan is to talk a little bit about the history of survivorship, and then talk a little bit from my perspective, how survivorship has changed over the last 20 plus years. Kind of an insider's view from a medical oncologist in terms of what I think patients go through and how I think that our view of the journey has changed, and it continues to evolve over time. But I do want to open it up that if somebody has questions or thoughts, you can just maybe put something in the chat there. Lindsay and Jenny, if it looks like people are asking questions and I don't catch it, please give me the high sign here, because I want to look in the camera so that people feel that I'm engaged with them. Lindsay and Jenny have done an awesome job of setting up a virtual interaction like this. Hopefully next year we'll be in person. So if you have any questions or want to chime in, please use the chat button. Looking into the history of survivorship, actually survivorship really came into being in 1986 with the National Coalition for Cancer Survivorship. And this was established actually in Albuquerque, New Mexico by a physician and a team of other professionals and patients. And their first stated goal was to change the language surrounding the journey of a cancer patient. And back in the day, they were really struggling, as I think we still do, with how do we word this? What is the language that we should use? In the 70s and 80s, it was really more of the cancer victim, which, you know, makes us all cringe now, because that's certainly not something that's very empowering. But the NCCS, the National Cancer Coalition for Cancer Survivors in 1986, their stated goal was to move the language from cancer victim to cancer survivor. And I think that that's been an important first step. They've been very active in a host of programs, and this is not necessarily a committee or organization that's well known to many of the patients or even medical providers, but they eventually moved from Albuquerque, New Mexico to Washington, D.C. in order to be really active in lobbying. They've been active in the American with Disabilities Act, the National Breast Cancer Coalition, Medicare Coverage Acts, and other organizations. They've actually become really the touchstone that most other cancer organizations that are better well known, they're the go-to person. So the Commission on Cancer, the National Accreditation Program for Breast Cancer, ASCO, which is our professional society, American Society of Hematology, ASH, everyone sort of looks to the NCCS for guidance on how best to address the needs of survivorship. Now, one of the things that I would say is that in addition to trying to reframe how we talk about survivorship, they're also doing a good job, I think, of redefining it. So from the very beginning in 1986, the NCCS has tried to reinforce the idea of survivorship begins at the time of diagnosis. And that's been a tricky thing to communicate, not only to patients, but also to providers, because many times there's a natural tendency to immediately think, okay, we've got this diagnosis, let's get on treatment. And then, oh, by the way, when you're done, then you'll enter survivorship. But really the idea is, and should be, and one that I believe that we've adopted here at St. Joe's, is that survivorship begins at the time of diagnosis, regardless of stage. Because survivorship really addresses four main things: the body, mind, spirit, and relationships. And I add relationships in there because I think that it's a different and unique element aside from the body, mind, and spirit. Certainly, cancer impacts a person's body in very real and tangible ways. And it's important that we address that not only in treating the cancer in whatever form it is or whatever stage, but also the impact of the treatments, the impact of surgeries, anything that really changes the body. And so that's where education on physical therapy, acupuncture, yoga, anything that can really help support the body is important. Nutrition is in there as well. And we can go into some of the details on those. But survivorship, one of the key points is really taking a person's physical experience and trying to improve it to a new normal, which can happen over the course of weeks, months, or even years. The second element, the mind, the psychological impact, the reality of this interruption in one's life journey is very important to address. And many times we're used to thinking about natural chapters in our lives. You know, we go to school, we graduate, we may go on to other education, or we enter the workforce. Particularly in June, this time of the year, we celebrate a lot of these changes, a lot of these, I call them page turners. We're moving on to a new chapter. Cancer happens, and all of a sudden, you're in a very new chapter that you weren't necessarily expecting. And that requires a lot of engaging your mind and looking at this new project that's on your plate that's not fair. It's clearly not fair, it's not expected, and there's a lot of fear that goes along with that. And we know from research in the survivorship realm that fear is one of the biggest things that we need to address. And that's tricky because fear happens in all areas, body, mind, spirit, and relationship. And one of the things that we're trying to do as a center, and each of us in our own practices, is trying to relay some of that fear, enforce hope, enforce optimism. And a lot of that comes through education, and education is very important. One of the other things that we're going to talk about a little bit is the spirit. All of us have religious and tradition backgrounds in terms of how we look at the world or how we seek the higher spirits. If we do, and some of us don't, and that's okay. But one of the things we need to understand during this journey, we all need to tap into whatever that belief system is, because it's probably going to be challenged. And we need to be able to support one another in that. And that's one of the beautiful things of having an established survivorship program, is that particularly at St. Joe's, we welcome any tradition. We welcome no tradition, wherever you are, ready to help you with that. And that can be very tricky. And then relationships, anything that interrupts the flow of your life is bound to impact relationships. We see that very suddenly in patients who need to take time off of work, or their responsibilities with other family members as caregivers can be impacted. And so we need to find a way to support that. Many times that involves putting our arms around the family and other caregivers, because roles shift temporarily and sometimes even permanently. And so it's important that as folks that are trying to support our patients, that we recognize and we honor that. Are there any questions? And again, if we were in person, I would be looking at people trying to get a sense, but I see a lot of boxes with names. So any thoughts or comments along the way here?
Dr. Schlesinger, thank you. You are so well spoken, and you just put all that in context so beautifully. Thank you. I don't see any questions yet, but hopefully people will feel comfortable just bringing up, where are you? What have you experienced? And how does some of what Dr. Schlesinger is saying relate to what you experienced, especially in trying to define what is survivorship, that it is when you're first diagnosed with cancer.
And I think that one of the things we can talk about a little bit if folks are interested is what the research has shown us about survivorship. And we can just look at all of this, the body, mind, spirit, and relationships. One of the things that we hear a lot, regardless of tumor type or regardless of the stage of cancer, is really the fatigue that sets in. And that fatigue happens pretty quickly. And what we're learning is that there's different causes of fatigue, and it's often very, very difficult to put our finger in an individual patient on what the main cause is. First of all, the psychological stress and the change in your daily activity causes fatigue simply by the stress hormones that shift in a time of stress. You also have altered sleep, your appetite changes, what you eat changes, and that all goes into fatigue. But what studies have shown us is that although you feel, and I think we've all had these moments, whether we've had cancer or not, when you're so tired, you just want to sit on the couch, that actually that probably is the wrong direction to go. And it's tricky to have conversations with patients and say, when you're feeling fatigued, take a walk, because you want to find that sweet spot. You want to find that space where you're pushing your body a little bit, but not too much. So one of the things that it's important to recognize is that during your cancer journey, you want to stay as active as possible. There is a tremendous body of literature that shows that particular yoga has an amazing impact on fatigue, but also treatment-related nausea, vomiting, and pain. And we used to think that, well, it's just that you're getting out and you're interacting with other individuals and that can lift their spirit, but there's much more to it. Physical activity is very, very important, not only during treatment, but after treatment. There's also really incredible research that shows that folks who are active after treatment tend to reach their baseline or their new baseline quicker. They tend to keep their body weight down. There's really some amazing work going into the impact of diet, exercise, and weight management in reducing the risk of cancer recurrence. And that's probably beyond the scope of our talk today, but certainly I'm happy to arrange a time if there's interest in that. So all this to say that it's very important that as you enter a cancer journey, either during or afterwards, that you pay attention to the physical. Physical therapy is important. We know that it improves lymphedema. Folks who have breast cancer, ovarian cancer, head and neck cancer are very prone to lymphedema. And so physical therapy can help with that. One of the other interesting points is that of people who have pets and enjoy taking their dogs for walks. I mean, it sounds very quirky, but we actually see that folks who have pets tend to recover a little more quickly. I think that there's a lot of elements that go into that. If you're taking your dog for a walk, obviously you're a little more physically active, but also the unconditional love of a small creature, or some dogs are pretty big, I suppose, but is very important in that positive self-image. So, and it sounds like we're trying to brag on our program, and I guess we are, but we do have therapy that not only reaches out to patients, but to our staff as well. During COVID, even though we didn't have as many patients in the center, our therapy dogs would actually go around to the cancer center, and we even took them into the hospital to work with the ICU team, because we know as a system the importance of that sort of interaction, that positive energy. Any questions, and I'm just looking at the chat room, or thoughts on physical activity? So let's talk a little bit about oh, no, I love it. I love it. What's your dog's name?
Child. Child.
Oh, so sweet. So you can probably attest to the fact that just having a little dog, and I see a question from Lynette here, and Lynette, I'll get to that definitely. Having just a companion can make such a difference, and a different support than another human being, which we also think is important. I did see a question in our chat box about, has physical therapy resumed? Yes, physical therapy has resumed. So if you have any questions on that, please reach out to Ginny or your physician provider team, and we can get you connected with that. Excellent.
And we have 2 talks this week from the physical therapy, the rehabilitation services team on symptom management and all the different services that can be beneficial and work with that. So there's one that today at, it's on my other screen, 1 o'clock, I believe.
Also,
Rehab's talking today at 1 o'clock, and then again, they're talking on Friday at 11 a.m.
Oh, that's good. I found them to be very helpful when I had PT after my mastectomy, but then they stopped because of COVID. So, and I had another surgery, so now I have more issues, that have arisen, new issues. So, yeah, I feel like I could definitely benefit from PT again.
Yeah, and there's really some fascinating research that I bet our rehab team will talk about, looking at physical therapy in the cancer setting, because many times we think about physical therapy for very specific lymphedema, leg weakness, carpal tunnel, things like that. But physical therapy is also very helpful in just general deconditioning. Deconditioning happens during periods when you're not as active. So sometimes after chemotherapy or after radiation, people have just slowed down. And getting back up to speed, there is a lot that rehab and physical therapy can do for that. Physical therapy is also often used in folks who have swallowing difficulties. They can partner with speech pathology to help. I'm thinking about our head and neck cancer patients who have trouble swallowing after chemotherapy and radiation. So the world of rehab is very important in the cancer community. So again, that whole body connection is very important. But let's move on a little bit and talk about the psychological impacts of having a cancer diagnosis. And again, it is a topic that could certainly have just a week of conferences on in and of itself. But like we talked about a little bit ago, cancer diagnosis is unexpected, it's unfair, it's very scary, and it impacts every aspect of our life. And so in some ways, it's also kind of a call to arms to acknowledge what's happening in your life, in our lives, rally the people around us, really move forward, acknowledging fear, acknowledging those moments of down, but expecting to move through it and actively trying to move through it. There's a great deal of research at patient expectations and patient thoughts about treatments and outcomes. And it's a very complicated world. And I don't think that we have any specific answers. I'll tell you that when I was a resident at UVA many years ago, my mentor and I did a project looking at hope and expectations of outcome with outcome in patients diagnosed with acute leukemia. And it was a small study. And what we learned from it was that there's kind of realistic hope, meaning understanding what you're up against. And then there's hope based on not looking at any data. And the folks that seemed to do well, regardless of outcome, were the folks that had education at hand, had support at hand, and were hopeful and expected that although it was going to be rough, they were going to get through it. The population of people that didn't want to know anything, they said, just sign me up, put the needle in my arm, give me the chemo, and don't tell me anything. They actually tended to do worse, probably because they weren't dealing with the reality. They just said, just sign me up, put me in the chute and go. And we know that that doesn't work very well. So the idea of having hope, having education, and moving through things is very important. And that calls to mind relationships. Relationships change when a person is diagnosed with cancer, and it's important that the whole family unit or the whole support unit really be brought into the treatment plan. We see this on the first floor in medical oncology. We see it in our radiation center. And interestingly, COVID has reinforced what we already knew. During COVID, the pandemic, we were limited in how many people we could bring into the center while we learned about this virus and transmission. And we knew inherently, the physicians and the nurses who were treating patients, we knew that limiting it just to the patient and not allowing family in or allowing them by phone was going to be very difficult. But I think we still underestimated the impact. We saw more symptom issues. We saw more confusion. We saw, in terms of plan, we saw less adherence. We saw people who were falling off their meds or forgetting appointments simply because in the treatment setting, we weren't able to bring everybody in. We saw that at the hospital too. Now I'm going to toot our St. Joe's horn because our administrators recognized that very early on and really tried to liberalize the rules for patients. We were able to do that as well in the cancer center. And so even before the system as a whole was allowing family members in, we advocated because we knew that it was very important that people have an extra set of ears, somebody to hold their hand, somebody who we as physicians and providers could talk to bring the loop full circle. So again, relationships are important. One of the other things that we need to understand is that many times, and I also almost think that it should be expected, that having a sounding board, whether it's somebody within the family or many times it's probably more effective outside of the family, whether that's a social worker, or a counselor or a therapist, when things start getting tough, having somebody who's not in the situation but is aware of this situation to walk through some of these issues with. Because even though you may love your spouse or your family members, sharing some of those personal issues with fear and sadness, depression and anxiety can be tough, because you also know that they're going through some of that as well. I tell my patients a lot, many, many times, that it's okay and people need to be open to getting help, whether that's just in a therapy counseling session or whether that's through medication. We know that depression and anxiety, all of those sorts of issues are very real. And on some level, they're expected, because those are neurotransmitters. Those are chemicals in the brain that get shifted. They get shifted because of stress. They get shifted because of medications, chemotherapies, other treatments. And so we need to be able to address those so that people can, in their mind and body, get back on track. And I tell folks all the time, and it is true, that during a person's cancer journey, more often than not, counseling or even medication for some of those neurotransmitter issues is normal. It may not be forever. It's probably not going to be forever. But again, we should embrace mental health with the same open arms and the same eagerness as we embrace chemotherapy and other treatments for the mind. Any questions or thoughts on that?
I just wanted to offer the different supports that we do have and more talks that we have this week. Jody Triple, our social worker, is talking tomorrow about coping after a cancer diagnosis. And then our psychologist, Dr. Moran, is talking on Wednesday. And she's talking about caregiving, because we find so many of our patients are in that role of being a mother to young children and having caregiving. That's their role. And so how do they then take care of themselves, or when we're older and we're caring for our parents? So I think both of those talks will be really helpful. And it just shows us that we have Jody Triple, our social worker, who can be a therapist and support, and then our psychologist, Dr. Moran, who does counseling. We also have survivors offering support, a one-on-one mentorship, and then Jody Triple and Karen down in the medical oncology area host support groups, cancer support groups. So we can offer you more information about that.
And I would dovetail on that, in that many times we think about caregiving with children or parents, but I think that there's a lot of caregiving, and we all know this inherently, just in any relationship. So for example, I'll just give a little personal information. My husband makes dinner more often than not. On the weekends, I usually do it. But if something would happen to him and he wasn't able to make dinner, now that sounds very trite, but these are the kind of details that I think impact us the most. If something would happen and he wasn't able to make dinner, that would have really deep impact on our kids and on me, and somebody would need to step into that role and provide food. Yeah, we could pick up McDonald's every night, but we know that that's not the right thing to do. And so folks who are, it's important to look at the big picture of who's going to pick up the kids and who's going to take mom and dad to their doctor's appointments, but it's also the nitty gritty of, you know, who's going to get groceries for cereal in the morning. It's those sort of things that kind of hit people out of the blue. And I think that hearing from other people, other folks that have walked this journey, is very important. I'll tell you another source of really great information and support are the nurses. The nurses see things through a very different lens than doctors, and that's important. And that's actually part of this beautiful puzzle that I think makes cancer care so unique. And so I can tell somebody, listen, your risk of this and this is 14 or 15, 25%. But the nurse is going to say, listen, let's just assume you're going to get it. Let's be prepared. And here's how I think you should handle it. So being a part of a system where everyone's voice is valued, those nurses are going to be able to also remind somebody in the treatment chair, or as they're talking about the pills that they're going to take, hey, remember, you may not feel well enough next week to get the groceries, so maybe tomorrow is the day to go. Those are the sources that I encourage people to tap into on a regular basis. And then the other point that I think is important, that is sometimes easy and sometimes difficult to talk about is just the spiritual realm. And more often than not, I hear people say that the unfairness of what's happening often cause them to really question their role in this big, beautiful universe. And again, it's hard to, because everybody's tradition is different, but I always encourage people to dig deep into that and to think about that, to go back into their traditions, or if they're exploring other traditions, to do that. Talk to their spiritual directors, talk to their pastors, and really lean in and not be afraid of that. Many times folks are afraid of questioning or being angry at God. And first of all, God is bigger than all of this, and so he can handle our anger. And I really encourage folks to walk through that, to be present in whatever they're feeling and just keep moving. It's when we stop moving that we get stuck. And that's just like when your car is stuck in mud, getting out is harder than just taking each next step and moving through it. I feel very fortunate that we are in a faith-based program here, but we're not channeled. Our spiritual care team understands and embraces all the different traditions or absence of tradition, whether you're agnostic, atheist, there is something for everybody in the spiritual realm. And I often encourage patients just to keep moving forward with that. And it sounds like I'm trying to be ambivalent about it because I want to respect, I don't know everybody's tradition, so I want to be respectful. But again, I do emphasize to everybody that whatever your tradition is, it's okay, and just keep moving and digging into that. So any thoughts on that?
It's me again. And we have spiritual counseling, spiritual care counseling, so you can call us and, you know, arrange for meeting with one of our chaplains. And then we have a beautiful chaplain, maybe a lot of you have already met, Maureen O'Brien, who comes through the infusion center and is exactly as Dr. Schlesinger described. She is not one thing or the other. She's just really talented and passionate about helping you explore what your spirituality is, what it means to you, what you dig into to find the strength that you need during these times. So it's beautiful. And we definitely have a very great organization, great environment for that here at St. Joe's.
And I think it's interesting, having been in other programs, that we're almost afraid of talking about spirituality because they were, quite frankly, afraid of offending. I think that the St. Joe's chaplains are open to everything and anything. And that's where I think our strength is, at least we have so many strengths, but particularly in that spiritual counseling and spiritual dialogue area. Any questions or thoughts? Again, if this was live, I would be, it'd probably be easier for people to feel comfortable chit-chatting.
Hi. My name is Tammy.
Hi, Tammy.
Oh, okay, good. First of all, I'm enjoying this, so thank you for this. I was diagnosed, I'm gonna say right now, in November, and it's it's been a journey. But the thing, when I tell people, okay, I got past my initial shock and my depression, and I went through all the nine, all that. So when I tell people, I think right now they more depressed than I am about it. So I don't like to really talk about a whole lot to people because it's like, oh, Tammy, so and so, blah blah blah. Right now I don't feel that way right now. I'm not saying I want the cancer, but I then came to a place where, okay, I have cancer, I'm gonna deal with it. So I just try to tell the main people that I have to relate to that I have it. But some people, they don't they get like I said, they get more depressed with it than I am with it right now. But I'm glad that this week is full cancer week because I enjoy. I mean, well, I feel like people need to talk about it because when you hear the word cancer, I mean, it my mind. I know when I first heard cancer, my mind went to places I didn't want to go. But I'm okay now. I'm okay now. I'm getting ready to have radiation. I don't know. I'm still draining. So after I finish draining, I'm supposed to go to radiation. But I'm just. I mean, I'm taking it every day. I'm walking every day. I get up and walk. So I am exercising.
And
I
Tammy,
always exercise. Uh-huh.
I applaud you. And what you're saying really echoes what a lot of patients say. And I do want to touch on the internet a little bit because I think the internet plays into a lot of things in a lot of ways. Many folks, once they get over the hump of the diagnosis, they sort of rearrange their framework for what's happening in their immediate life when they've already made so many more steps. And when you tell somebody else, hey, I've got cancer, they, depending on how close they are to you, they have to then process that information. And it's hard for them many times to catch up with the patient because the patient says, okay, I got to do this. Here's my plan. They start rocking and rolling. And the friends who may be bringing their own baggage to the table, who knows what their experience is, that colors their impression of the patient. And what I tell patients all the time is your cancer diagnosis is a part of your life, but avoid having it define your life. And what I hear from folks who are going through cancer is that they're good with that. They're able to move beyond and have it not define their lives, but other people have a harder time with that. And it's very common for folks to be in your shoes, Tammy, and voice the same thing, that they're doing well with it psychologically, they're moving forward, but other people aren't. And this sounds really harsh, but sometimes you just got to leave them in the dust because you got something to do. And that's not meant to say that you abandon friends, but
I understand.
yeah, you just got to keep moving forward. I
Yes.
think that the internet, if I had one thing I would do when somebody gets a cancer diagnosis, I'd unplug their internet because the internet is so powerful in this age of information, which I think we're going to look back on and they're going to call it that. There's some people already referring it to that. Our brains are incapable of taking in all this information, synthesizing it, particularly if our background is in something else. So one of the first things people do when they or a friend get a diagnosis is they plug it into Google. And if you know anything about Google, it's there's a lot that goes on behind the scenes to generate those first 2 pages of what comes up. And so you have to be very, very careful about what you're reading, and you have to be able to read it with a little bit of distance. When you're in the fire, it's hard to read it with any sort of distance. So again,
Right.
when people will tell me, well, my Uncle Joe told me I should be doing this and this, and I often have to backtrack them and say, that chemotherapy is actually not even used in your tumor type, or you don't even need that, your cancer is not that bad, or hey, I think we got something better, we're going to use pills, targeted agents. So you never know where somebody's coming from when you give them the news of your diagnosis. So I tell folks all the time, just be careful who you tell and be sure that you're in a good place to share that and also receive what they say to you. It's a time for reevaluating relationships sometimes too, and saying, it's putting a little distance to some folks saying, hey, listen, I need to focus right now. And it's always tricky, but hey, I'll get back to you in a couple of weeks. Sometimes you got to do that because you got to take care of yourself and your very inner circle.
I'd like to jump in for a second. A participant named Melissa just put in the chat, that's what I need help with, not letting it define me. I am 2.5 years out, and every day it is in the forefront of my day. I am always aware of the aches and pains.
Melissa, and I applaud that you're able to vocalize that. because that's really one of the first steps in terms of being able to move through that. And when I see aches and pains, and maybe it's just who I am, how I'm wound up, but I see aches and pains as probably physical and also emotional aches and pains, and both of them need to be addressed. The way to do that is through rehab, and maybe talking to your docs about whatever kind of rehab is appropriate for you. Physical therapy, yoga, acupuncture. You got to address that physical, and sometimes we can't make it all go away, but finding that sweet spot is important. But the emotional part, and if you're living in that moment of it defining you, Melissa, it doesn't need to, but it's going to be hard, and you will get through this. I would definitely say that reaching out for some one-on-one talk is going to be very important. And we all come to the table with different experiences and different pressures, and that does impact our long-term journey. So Melissa, I would say to you that I appreciate your strength in being able to say this in a setting like this. And I think I see other people nodding their head. And if you feel comfortable, you can reach out to Ginny. I don't know if you know Ginny, but she'll be able to really hear you and help you walk through what you need to do to get through this. And I know you'll be able to get through this. For some people, it just takes longer. And again, I would also think about, and it may not apply, but if there's people in your lives who are also defining you that way, and that's kind of where some of that boundary needs to go as well. So I don't know your whole experience, but you're not alone. You're not alone. Ginny, do you have any thoughts or ideas?
Exactly what you said in the beginning. The first step is awareness. So it's wonderful, Melissa, that you, hopefully it came, through this open venue today to be able to notice that that's what it was defining you and not a part of you. So the first step has been taken, and now you can work to have it just be a part that you deal with and that you cope with as best you can, so that your quality of life, your health and your wellness is as good as it can be. So yeah, we're here for you. So please email us or give us a call, and we can start a nice conversation and plan for how to really help you keep moving forward.
So for many years, this may sound way too off the wall, but many years ago I was at the Smithsonian, and we were at, I'm assuming it was the Natural History, and I was looking at this tapestry that was made by this Native American group. And there was, when you look real closely, sometimes you would see really, really thick strands. Sometimes they were worn, sometimes they weren't. And if you look real closely, you see it. But when you step back, it was just part of a beautiful, beautiful tapestry. And that really stuck with me. And I think that any major life event, in the heat of the moment, as you're weaving that very thick straw braid, or wherever you're weaving that, it's right in front of you. And sometimes it's a couple of rows, but over time you will start incorporating other strands. And when you step back, your cancer journey will be one part of you or your tapestry, but it's about incorporating other strands in there. And that can be a long transition. So I don't know if that helps at all, but it's something that stuck with me from the Smithsonian. So it sounds like I'm plugging the Smithsonian. I guess I am, now that we can get out and
Yeah, exactly.
I guess I don't know what the rules are anymore. So,
That's
but
great.
Melissa, definitely reach out. We're here to help you.
And I'd
And then Melissa,
so
go ahead.
sorry. Another message, a sweet message just came in from Joy. Joy, she says, I'm 5 years out, and I would like everyone to know that it does get better. Be aware of when you finish the medical part, it will hit you emotionally. And with that, I'd like to just remind that we do have therapists on staff. We have a social worker who can also work with you. So if you're having trouble finding somebody, don't hesitate to reach out to us. I'd be happy to put you in contact with somebody.
Yeah, thank you, Lindsay. And that is a great reminder, Lindsay, for me to talk about. There's several transitions that cancer patients go through. First of all, that first one, stepping into the room, over the threshold of the diagnosis. Then the next one, which in some ways can be trickier, but sometimes is more, brings more peace, is the treatment part. Because the treatment part, all of a sudden you got a plan, you got a calendar, you know what to do. It's a little bit different if you're on chemotherapy where you're actually got a schedule, or if you're on oral agents where you may not be in the center as often, but either way, having that treatment plan in front of you gives you direction. The next transition that is sometimes the most difficult is that transition from completing therapy or pausing therapy, because we all know that there are cancers that we don't cure, but we move into more of a chronic state. And some patients don't ever have that end, no more chemo, you're done for good sort of thing, but they may go on pauses. That end or that pause can cause a lot of anxiety, understandably, because all of a sudden you don't have that schedule to follow, and you're shifting back into more of a observation or a maintenance phase. And so as we start treatment, our team often starts prepping patients for that second part, which is what you're speaking to, Joy, that after the treatments or during a pause, then all of a sudden, sometimes the mental part and the spiritual part comes rushing in, because patients have been able to sort of put that on the back burner a bit. So yes, Joy, you are actually very spot on there. That transition out of treatment can sometimes be a little more challenging than one expects.
And our next speaker at 11 o'clock is speaking very much to that. Her title is After the Crisis. And it could be very helpful to see how she experienced and now is able to tell the story and has many tools to help along the way of, the initial treatment, and then how she, dealt with the effects of that, and then finding where she is now, which is very successful, very at peace, I think. And so please look forward to that.
I appreciate all the chat comments here. That's wonderful. Thank you for being open to this.
And I've included my phone number and email address. Please don't ever hesitate to reach out. I'm, can get back to you as soon as possible, and I'm, happy to navigate any waters with you.
Any other questions or things that I can speak to? One of the things that comes up a lot in this sort of dialogue is the idea of mental changes and thought processing. And I hate the term, I absolutely hate the term, but I'm going to use it because everyone's usually familiar with it, is chemo brain. And chemo brain has been studied a lot. There was actually a pretty big study that came out of Virginia Commonwealth University, which is one of the main institutions in Richmond, Virginia. A practice that I was in many years ago actually participated in trying to identify what is chemo brain or chemo fog, and understanding how do people go into it and how do people come out of it. And what I'll say, and what I tell patients a lot, is that this idea of chemo fog or chemo brain, where you feel like you're forgetting things. You walk from one room to another and you forget what you went into the room for. You can't find your keys. Most of these sorts of things that we as individuals experience, but others around us, except our closest family members, usually do not. The most extreme example, I had a woman many, many years ago who was a high-level accountant, and she was one of those math minds that could look at a column of 20 numbers and do the math in her head. During chemotherapy, she had to use a calculator. Now, for her, this was devastating, and she had a great sense of humor about it. And I said, well, now you're human like the rest of us. But what's happening is that the brain can only take in so much. And it's not just the treatments. We do know that treatments can alter the biochemistry of our brain, and that's why we see more anxiety and depression. And that's why I reassure folks, listen, if you need to take something for the anxiety or depression, take advantage of it. It will probably come off as you move out of this journey. So we know that there's biologic effects from treatments, but the study from Richmond also showed that what cancer patients experience is very similar to what people who are going through bankruptcy, or God forbid, the loss of a child, or a very, very difficult divorce, or any major life issue can cause the same processing issues in people even when they're not on chemo. And it just has to do with sensory. It has to do with changes in sleep, stress, changes in eating patterns. So there's a lot that goes into it. Physical therapy and actually speech pathology has been shown to be very helpful. One of the tricks to chemo fog is to keeping the brain finely tuned. So we tell folks, and I'm stealing this from my rehab colleagues, do things like crossword puzzles, word finds, card games with another person. The computer card games are good if that's what you need to do, but anything that kind of gets you interacting with another person is better. Playing Monopoly, I hate Monopoly, but whatever you want to do, any Parcheesi, whatever your game is, anything that kind of gets that brain rewiring and doing something that's distracting but still exercising the brain is helpful. Sudoku, I'm probably saying that incorrectly because I can't do Sudoku, it's just beyond me. But if that's how your mind works, then use something like that to keep on track. Speech pathologists can also help through word games and other things. So folks who are really struggling will often refer for neuropsychiatric testing, some exercises, and get them back on track. So chemo brain is common. It does resolve. It just takes time.
And a little bit of effort, like you're
And a little
saying,
bit of
that's good. And I really wanted to offer again any other questions that people may have or comments. Dr. Schlesinger, the way that you were,
Sorry.
no, please go ahead.
I did want to say that, you can be at one stage in terms of healing and where you are in progress, and then you can take a step back. Like, I'm sure there are people with different types of cancer survivors here, but I had stage 3 breast cancer 2 years ago. And then I finished my radiation following my mastectomy a year and a half ago. And I said, okay, now I'm ready for my reconstruction. And I started that process in April. And unfortunately, I had complications. I just was released from the hospital a few days ago. I had to have my tissue expander removed, but it brought back a lot of memories of the, initial disfigurement, of the surgery, and finding out I had stage 3 breast cancer, which was a huge shock. I have my mammograms every year. I'm the person who's a year and a day for everything with my, follow-ups. I would do exactly what I was supposed to do. And I was like, how, why? So now I said, well, I think I'm ready. They told me to wait a year for reconstruction. I'll do a year and a half. That went bad. And I thought, here I am kind of back where I started 2 years ago. And, it's not a good feeling. I thought I was progressing and kind of leaving all that behind me. And now I'm like, oh, and now I have to think about a different option next year, a flap maybe, or something like that. I'm like, how much can you go through? Like, how long can we drag this out? It's getting kind of ridiculous.
And Lynette, my heart goes out to you. And we hear this a lot, particularly when people are between appointments. It seems like, and I call it leapfrogging, when you move from one appointment to the other or one event to the other. And during that downtime, everything feels good. But then as you're getting ready, or when you've experienced a setback of any kind, it takes you back to the beginning. And I would encourage you, I bet that even though it feels like you're going back to the beginning of all this, I bet you're further along than you think, because you sound like that awareness is so important. So I applaud you on that. But there are setbacks, physical and emotional, that can happen. And I think that's where you have to regroup and decide how far you want to go into that regrouping before you reach out. I'm really a big proponent of reaching out for help, because many times, I know for myself, you can get locked in up there, and you need somebody to sort of release that vent a little bit and give you a different perspective, reinforce your strengths, and show you that you've got those strengths, you've got that skill set. Let's start moving forward again. And it sounds like you're doing that already. So I wish you all the best.
So, Dr. Schlesinger, I can't thank you enough. You make this all so compassionate, understanding, and supportive, where I think that the idea of survivorship and the four components that you talked about, body, mind, spirit, and relationships, and looking at all of those and how they need to be supported, and then how each of the patients, each of you can be empowered to do that. And that's a really important thing, with one of us today talking about having an increased awareness of where they are, where they're stuck possibly. We have all these support services here at the Cancer Institute, an incredible team from the ground floor all the way to the third floor. To help empower you and to be part of the team. You're part of the team as well. So with survivorship, I think, you really helped us understand that, Dr. Schlesinger, and we're very, very, very lucky to have you as our medical director, and for those who have you as your oncologist. We really appreciate it.
I appreciate being here.
Yeah.
And you can, our whole team is here. If you have any questions, you can certainly reach out to Lindsay or Jenny, and she'll get those questions to me, and I'll be happy to respond. So I wish you all peace and joy and many blessings. I know that your next speaker is at 11. I would definitely encourage you to sign up and register for any and all of these. Some you need to register for, some of them you just need to log in. Jenny and her entire team have really put their heart and soul into this. So maybe 5-minute bathroom break, and then y'all can get back online and hear from our other team members. So Jenny, I'll log out now, but if you have any questions, folks, please reach out.
Yes, Dr. Schlesinger, thank you very much again.
Thank you.
Bye-bye.
Jenny asked if Cassie is doing her healing time.
Hannah, I'm here. You broke up a little bit. Try that again.